So while my message is going to be not really a message, while my discussion is going to be about health insurance, I want for you to understand that health, having your insurance card, is not only about prevent about treatment of illness, but prevention of illnesses. Is that fair enough? All right. So what I want everybody to do is to take out your insurance card. I want you to take out your insurance card. I want you to take out your insurance card, and I want you take out your insurance card. So, tell me what is on the card. Tell me what defines your insurance on your card. What does your insurance is what? Your name, okay. What else? What type of insurance is it? So you're telling me the name of the health plan. I want to know what kind of insurance it is. Take out your health insurance card. PPO. Your NGO, NJ Direct. So you work for the state of New Jersey. So you have a PPO plan. You have one of the best plans in the entire university, NJ Direct. So, I mean, when I worked at Blue Cross, that is what was one of the best plans, NJ Direct. It's a PPO plan. You have unlimited, unlimited, unlimited. So we're going to talk about other people, probably not you, but so PPO, what else? What else is on your card? What is it, PPO? PPO. So that's what I'm looking for. What else? PPO. I've heard PPO. She has what? No, not the name of the health plan. What kind of insurance is it? No, but I'm still with you. I'm still under PPO. Does anybody have an HMO? You have a PPO? You have an okay. You have an exclusive preferred. You're very fancy. They don't have too many EPOs around. So PPO, I heard PPO, and what else did I hear? Darren, what do you have? Darren has an Omnia plan. Now the health plan is Horizon Blue Cross Blue Shield of New Jersey, but the type of health plan is Omnia. What did you say your insurance was, my sister? You have a United Healthcare, but you have a PPO plan. What else? I heard Independence. Who says Independence? And what do you have? So you have a PPO. What else? You have what? Medicare. We're going to get to Medicare, but tell me what kind of Medicare is it? What does your card say? No, but she's telling me Medicare. Medicare what? Self-funded plan. We'll get to that. We'll get to that. So I'm still trying to find out what is it? Yeah. What do you have, my brother? No. What kind of health plan is it? Jessica, what kind of health plan do you have? You have a PPO. Does anybody have an HMO? You mean you have POS? What does it say? POS? POS. That's a point of service. Do you know what it means? Okay, but point of service, do you know what it means? PPO, not what the acronyms mean. So POS is a point of service plan, right? PPO is a preferred provider organization. But what kind of plan is that? When you picked the PPO, what were you picking? When you chose the point of service, why did you select it? Why? You didn't have a choice? Okay. Referral? Okay. All right. So that's the PPO for you, right, my sister? That's not what you have. Recently changed. Darren, why did you pick what do you say Omnia? Why did you pick Omnia? What is Omnia?
Well, that was what was available to me on the New Jersey, I guess, portable. It's not the health direct or whatever they call it in New Jersey government website.
So you just
And
picked what was available to
picked
you.
the middle plan that was available to me that I thought was reasonable price enough. So
Reasonable price enough. All right.
But but
Go ahead.
but don't you have like a gold plan, silver plan, and all that?
Well, those are within. So we'll get to those in the question and answer, but those are within a lot of times the Affordable Care Act. So I'm just trying to see if people know what kind of insurance you have, right? So we have an insurance card, and we go to the doctors and we go to the hospital, but do we know? So there are several types of health plan. One is an HMO. Have you ever heard of an HMO? Do you have an HMO? So what is unique about an HMO? What do you know about your plan? So can you go wherever you want? Why? What is unique about an HMO? So an HMO plan is driven by what we call a gatekeeper. You have to have a primary care doctor, they say PCP. Then that doctor has to do all the referrals. You cannot go out of network of that plan. So if you need to go to a hospital in New York, you probably can't. You are restricted to the limitations of that HMO plan, and it has the gatekeeper, and the gatekeeper is a physician. You always have to get a script of where you need to go, because if you don't, they won't pay. So that's an HMO. Darren, I told you a little bit about your plan because you didn't know. What is unique about the Omnia plan?
has to be within the preferred provider network, which is set by the insurance company. In my case, it was us.
So, and what is also unique about an Omnia plan? He has to stay in his network, but the providers that are in that network have to say that they're value based, meaning it's just not any preferred provider like is in the HMO. These providers have to always give value to patients, so they're monitored more frequently, and they have to ascribe to certain sort of value metrics. So it's a very strict plan about that the Omnia plan. What is it about the PPO? Tell me what you know about the PPO plan.
You get that out of network restriction also.
Say that again.
The out of network.
You have outer network coverage.
From your reaction, it's good.
PPO plans are typically the most expensive plans, but they give you the most freedom. So you don't have to have a gatekeeper. You can go wherever you want to go, but they're very expensive plans. Um, Now, the other one we mentioned was the point of service plan. I have a point of service plan, but it is more limited. I mean, because I work in a hospital, I chose the point of service plan because I can get services in the hospital, even though I don't like to go to the hospital where I work. But you can get services in the hospital, but it's a little bit more restrictive than the PPO plan. You do have outer network, but your co-insurance and your deductibles are higher. So I'll talk about that in a little bit. Other insurances that we have are traditional Medicare. My sister, you said you had Medicare. Do you know which Medicare? You have Medicare A and B. So you have what we call traditional Medicare A and B. Um, there's also Medicaid. Anybody has Medicaid? All right. So there's
Can we ask questions along the way?
yeah, yeah, yeah.
Sister Rose says she has Medicare A and B,
Mm-hmm.
but D is prescription drug.
Yeah, we're gonna get to that in a minute. I'm gonna talk to.
Whether you advise that, whether
All
your
right.
customers get it.
So she has Medicare A and B, right? And I'm going to go over a little bit of what the different Medicare plans cover, but I just wanted to just to give you this foundation of what kind of plans you have, and let's start there. So she has Medicare A and B. She doesn't have a C, and she doesn't have a D. So I'll go over what the difference is in all of those. But Medicare A and B is fee for service Medicare. It is funded by the federal government. I'm going to go out of my, how do we get Medicare?
65.
What other reasons can you get Medicare?
Disability.
How long? How long do I have to be disabled? So there are three ways you can get Medicare. Say that? Senior, but senior, I feel like me and Brother GD are seniors.
I'm only 60 right now.
I got an AARP card. What is, how do you get Medicare? Sign up. But what are the eligibility requirements for Medicare? You're 65. Somebody said 65. That's one. What's the other way?
I think 10 years or something, but I don't remember. I'm only 60.
A disability. But how long do I have to be disabled before Medicare kicks in? So it's 2 years of disability. While you're waiting on that, you have to be on SSI, you know. So you have to be deemed disabled. You have to wait 5 months, and then it's two, and then you can get that Social Security check. Then after that, it's 2 years before you can get Medicare. So we talked about disability for 2 years, 24 months, then also 65. There's a third reason you can get Medicare. What's that third reason? No.
Medicaid.
What's the third reason you can get Medicare? Dialysis. Correct. So, three reasons you can get Medicare. So, 65 and above, you're disabled for 24 months or more, or you're on that hemodialysis, right? So, those are the three ways you can get Medicare. Any questions so far about the types of insurance? So, I went over HMO, the PPO, point of service. You can get Omnia, you can have traditional Medicare, you can have Medicaid, and then you can also have managed Medicare. So I'm going to jump around a little bit. My sister has Medicare A and Medicare B. Some people, when they retire, choose Medicare C. What they then do, they allow Blue Cross or United or one of those places to manage their entirety of their Medicare. So they get A, they get B, and then they get the D, which is the prescription. You have to buy D. And so this is the reason why a lot of people don't have D. I work, I get A and B, but D, you have to pay for it. Do you understand that? So your prescriptions, D covers your prescriptions, but you have to pay for it. And I'll tell you a little bit how much you have to pay. So a lot of times if you see you hear seniors saying I can't afford my medications, is because they don't have D and they don't have C. C is now I'm paying a premium to Blue Cross, and I tell Blue Cross, okay, you manage my Medicare for me, and then Blue Cross manages my A, my B, and gives me prescription, which is equivalent to the D. Does that make sense? All right. So these are the ways. So tell me the next thing I want to know, how do you get health insurance? How do we get health insurance? How do you get it? I talked about how people get Medicare. How do you get Medicare? Huh? Work? A employer. So the employer sponsored. How else can I get insurance? You can buy it? Okay. What is that recently? What was that law? I mean, it's a fancy word for it, but what do we call it on the streets? Obamacare. So we get to Cobra. So one, we can get employee sponsored. You can buy it through the Affordable Care Act, or you call it, we can call it Obamacare. What's another way?
Well, the government is the biggest provider of health.
Well, the government provides Medicare, federal government.
Veterans.
Well, yeah, veterans, but I'll do that in a minute. But so we have employee sponsored. What's the other one? Cobra. Okay, so I'll jump. How we get Cobra? What is Cobra?
Let's say you lose your job, right?
Mm-hmm.
If I remember correctly, you lose your job, you only have a certain amount of time before your insurance will stop
Mm-hmm.
supporting you.
Mm-hmm.
So then I think Cobra is that avenue of option where
Yeah, so that's basically. So I'm working for a company that has, it's a little pop and mom and pop business. There are 10 of us. Is Cobra applied to me? Does it? So I'm working for me and Darren and Jessica working together. And we have a company of three.
Yeah, man.
Does Cobra apply?
No.
No. Yes. So you have to have 20 or more employees to be eligible to have the Cobra benefit, right? Okay. So we go back. Cobra, your employer can sponsor you. Who else? And we can get Obamacare, private pay, which is sort of the Obamacare that's self funded. You talked about the VA, so let's loop that in. How do you get VA benefits? What is that insurance called if I'm in active military? I'm I haven't I'm I am still active military. What is that insurance? TRICARE. I have left the military. What is that insurance? The VA. So, okay. So we've gone through all of those. So you can buy your insurance. You can get it from your job. You can do it you can do Cobra. Cobra is exceptionally expensive. Um, when and I think in my transition before I moved, so you guys know I used to live in up there where Elder GD lives, and had a house there living by myself. And every time it would snow, I would call Darren to come up to shovel, and he got fed up with me and says, "You need to move." So I ended up moving this way, leaving my house and coming and living in an apartment down where they live because it is now convenient for them. But you know, so before I when I lived up in that area, there were certain benefits that I have up there that I don't have down here. But I was going to say something. I completely lost the train of thought when I was going in there. So employee sponsored, individual purchase, indemnity. Oh, I forgot indemnity. Indemnity is a plan that I pay for my insurance, pay the doctors, and then I pay for my services, and then my insurance pays me back. So that's an indemnity plan. A lot of companies are offering that now. I had that at one time where I would pay out of pocket for the expenses, then the company would reimburse me. So that's called an indemnity plan. You really want that if you're maybe young, like the McDonald and stuff, you really don't got any issues, because that can become really expensive. Because you never know, because if you have a catastrophic illness, if you need surgery or thing like that, the cost of that could be so cost prohibitive. So you really want that if you are really healthy. Oh, I know. I lost a train of thought. So I had Cobra. I was working in Jersey City at Jersey City Medical Center. And just in the transition to this job down here in Mercer County, I paid for Cobra. And I think it was like $800 a month. It was exceptionally just to match what I have from RWJ Barnabas, $800 a month. So I paid for it, I think, 2 months while I waited for my job to kick in. All right, some of the terms that I want you to know before I go, and what is out of network?
More money.
What does out of network mean? Well, if you have a PPO, is it covered?
Technically, yes.
Perfect. Yeah. Out HMOs don't have an out of network benefit, but PPOs and point of service do have an out of network benefit. The co-insurance and the deductibles might apply, but out of network is, hey, you're going outside of, it's like, what is a good example of that? You have six, the insurance company determines what their group of doctors are, and you want to go outside of it. When Jessica was sick, I wanted to take her to CHOP, Now, CHOP is in Philadelphia, and so I had a point of service then, but I could take it to CHOP. I got the services, but I had a co-insurance and a deductible that applied. So that's why it's good, I think, to have either a point of service plan or a PPO plan because it gives you the freedom to go where you want to go. You pay more for it. Go ahead, my brother.
Oh, yes. Question. So I've recently got some checkups and things, and sometimes they'll be like, "Oh, you pay the deductible" or something like that. But then in the mail, I get a check back to me. Like, what's that about? Like, where it's almost like I didn't pay for it. They're almost like it's like a game. Like I pay for it now, but then they give me a check later. Okay.
So let me just say something. Some employers, like Jessica works for Bloomberg, the state of New Jersey, they have some really fantastic plans. And maybe you work for a company that has really fantastic plans. You're in all of us can have Blue Cross, Blue Shield, but it's covered differently. And it's covered differently based on what your employer pays for. So Bloomberg may say, pay for everything for my employees. Then my little company may say, well, if they have this, then charge them this. And if they have that, then charge them this. So it's really your insurance is dependent because some people will tell others, oh, choose Blue Cross because it's good. But it's really employer driven. You have to understand it's what your employer pays for. Your employer determines what type of benefits you get. In Medicare and things like that, it's everybody. You had your hand up, my sister? Mm-hmm. They may be eligible for some the prescription part of that. Yeah. I don't know. I must confess, I don't know a lot about PAD, but I don't know it exists. Right. So we talked about out of network. What is medically necessary? What is? Give me a second. What is medically necessary? So I have insurance, and I go to the hospital, and the insurance doesn't pay. Why?
Because some bureaucrat somewhere who knows nothing about medicine decides that you didn't need to have your colon taken out when you're whatever. It's crazy.
So if I have insurance and I go to the hospital, does the insurance pay? If I go to the hospital, if I go to the hospital, if I go to the hospital and I am admitted and I'm lying in a bed and I have an IV in my hand and I get antibiotics, does the insurance have to pay?
It always depends. Lawyers are gonna lawyer up.
Yeah,
Everything depends.
the answer should be yes, but
I want to stay on this for a second, and I saw a hand up there. If I go into the hospital and I have a colonoscopy, does the insurance pay? Have to pay?
no, they don't have to.
Do they pay?
Sometimes.
Okay. So, 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 so all the insurance companies, Medicare and those people, they look back. Medicaid would look back. Medicare can go in and audit charts. So that is retrospective, right? They'll go back, they'll look at the charts. They'll go to the hospital, they'll look at the charts, they'll go to the insurance. But all insurance companies, if I show up to an emergency room and I get admitted to the hospital, the insurance the hospital has to send to the insurance company what is called a notice of admission. Cynthia St. Jelice was admitted to Princeton Medical Center for X diagnosis. There are nurses at the hospital who send that clinical information to nurses at the insurance company based on evidence based standards of care. They will look in it and say, we're not going to pay the hospital because you don't meet the criteria. So, for example, I go into the hospital, I have abdominal pain. and I feel like it's so bad I can't move, but I go to the hospital and they give me something to eat, or I can open my mouth and I can take pills by mouth. Insurance company won't pay, no matter how long the doctor keeps you there. The insurance company won't pay. So the term that I was looking for, and sister, I see your hand, and my aunt keeps calling me from Antigua, and I don't know why. Um, the term that I was looking for is medically necessary. Your services must always be medically necessary. If my knee's hurting me, but I haven't gone through the process, I can't just go and say I need a knee replacement. It has to be medically necessary. I can't just go and say take my colon out because I don't like it no more. It has to be medically necessary. And they use evidence based standards of care criteria to determine that. When I worked at Blue Cross, I was the nurse receiving the information from the clinicians at the hospital. And we denied, and we would say to the hospitals, I am not telling you to discharge the patient. We're just not paying. And many, many hospitals are not paid for the care when people are lying in the hospitals. You go to the hospital, you see them in the hospitals. Many, many hospitals are not getting paid. The other thing, and before I forget, if the insurance and you make an agreement, it's contract, that for this particular procedure, you're only going to pay for 3 days, and I am in there for 10 days, the hospital doesn't get another penny. And that's why you see the hospital struggling right now, right? So, whatever that DRG agreed upon rate is. So, when you go to the hospital and the people are saying it's time for you to go, it's not only because, you might be able to get your care elsewhere, but because a lot of the times the hospitals are not going. I saw the sisters over here hand. Let me just go to that. Sister, hey, how you doing?
I don't know. It's because one time I was working for an employer and he said that the type of, I think you said it was an insurance called AFLAC. What does that do? That's the only thing called. What does?
Isn't that, I don't know much about that. Isn't that a automobile insurance? I feel that's an automobile insurance. So 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 let me just tell you a brief thing about automobile insurance if you go into the hospital. If you go into the hospital, your medical, they typically they run both, right? Your Because what happens, automobile insurances usually have a limit, right? So what you never want to do is say only use my automobile insurance. You want to use your medical, and then they will, what we do a coordination of benefits. They'll bill the automobile insurance, whatever your max, and then the medical should pay. But it's very important that you understand if you that um, if you have a car accident or anything, you can always say use my medical. You had your brother.
I think Aflac is something that pays you because you're out of work because of the injury.
Workers' compensation.
Yeah, it's
So if you're
a
injured at
private thing. It's a private thing.
if you're injured at work and you go to the hospital, that is called workers' compensation. Your medical will not pay at one penny at all. If you're injured at work, any work related injuries, that is workers' compensation, and your medical will, it is an exclusion in the state of New Jersey for your medical to pay for workers' injuries.
AFLAC. So something that I know that I'm very familiar with. AFLAC is a supplemental policy. It's something that makes us employers look good that we're providing something for the employees that cost us very little and has very little use. It's supplemental policy, so your health insurance has to be claimed on. So let's say, for instance, you have cancer. Your health insurance takes care of it, and over and above that, if there's other things that the health insurance doesn't cover, then you can apply to that policy.
Okay, so that's
So it takes
AFLAC. See,
it takes
like
a
I said,
long time for AFLAC to pay anything.
so I'm not as familiar with AFLAC. It's not something that comes into my preview a lot.
It's very useless, almost useless.
So a couple other terms I want to go to is what is your deductible? What is your deductible? What is a deductible? But let me back up first. What is your copayment? What is your copayment? What does that mean? When they say you have a copayment, what does that mean?
It's on your card.
A payment.
So I go to the doctor, and the receptionist says, Cynthia, you have a $20 coinsurance. Isn't that what you usually hear?
Copay.
That's your copay. That's your coinsurance. This is what you have. It's a set amount. It's $20 for your PCP, maybe $35 for it's your coinsurance, and you must pay it every time you go to the doctor. You don't get to not pay it, right? So that is your coinsurance, and that is also determined by could be determined by your employer as to how much they want your cost sharing to be in in a copayment. Jessica, do you have a copay?
No,
Probably
good
she don't.
companies don't have it.
Yeah, a lot of great companies don't have it. Yes, my brother. Go ahead.
What is the purpose for the copay? Can it ever be where you could just go and just get the attention and not have a copay?
No, no. It is what your employer has deemed in their contract is so you they take a certain amount out of your paycheck every 2 weeks or whatever, right? Your employer does and say that goes towards the insurance. But in addition to that, they can say that this is part of your cost sharing as well, right? So your cost sharing, all of this is your cost sharing in your healthcare cost, right? So they'll say for every time I go to the doctor, I have to pay $25 to a regular PCP. Every time I go to a specialist, I pay $35. It's my so it they always you always have to pay it.
Question. Answer. Follow up on that one. I have a friend that has a New York plan that has no copay. If he sneezes, he's going straight to the doctor. Copays prevent abuse of policies because if you have to pay something, people think twice before they go. And this
But
guy
I
is
think some people go to the ER anyway. And those companies that are great like that, they have clinicians, maybe an NP like sister who are on site. Who Jessica probably you have an NP on site, you have a clinic on site. These are great companies that have clinicians on site that their staff can go to and write scripts and
this
things
is
like that.
public insurance in New York.
Yeah,
This
in
is
state of New York.
in New York, yeah,
Oh,
and there's no copay.
let's not even compare the state of New York and the state of New Jersey insurance to regular people. They have everything.
Exactly. They have everything. Yeah. State of New Jersey. I know.
Hmm. What you're defining there, if you are a two parent household and your children are on both plans, it's called the birthday rule. So it will go with the person's who birthday, not by year, but the time of month. So that's the birthday rule, right? So if you know that you have better insurance than a spouse, maybe you just not put them on there or something. I'm not saying what to do, but it will always go the birthday rule of the person if you're born earlier in the year. Go ahead.
Sorry, so I have a question. Going back to brand medically necessary. Is it the same team that manages the hospitals, um, getting the prior authorizations done that does for the pharmacy? Because a lot of customers, when they come to the pharmacy to pick up, and you tell them like the doctor put on the prescription, brand medically necessary, and we can't change it, they will tell you like, oh, I was just in the hospital and they cover this brand medication, so why are you telling me it's not covered at the pharmacy? So is it the same?
So no, the people who typically do prior authorization are a different team of people than those who are doing what we call utilization review. And then there are next set of people who do reviews for rehabs and things like that. But prior authorization is a little bit different. And some drugs, based on the brand, because of they're so costly, too costly, and so some companies exclude them from coverage, and then you have to get, well, either have to get the generic or what or something else. So, guys, we talked about out of network. We talked about medically necessary. Whatever services you get must be medically necessary. We talked about co-payment. What is a deductible? What is your deductible? Anybody, look at your card. What is your deductible? What is your deductible? What is your deductible? So, on your card should tell you what your deductible is and what your cost sharing is. What is your deductible?
5,000 per family.
Your deductible is 5,000.
5,000 per family.
It says it on the card?
Yeah, deductible is
2,500 individual, 5,000 family. It's high.
Yours is 500.
Mine says it's
Yours is 3,000. So what does it mean?
It means they don't have to pay you until money I have to pay out of
Spend
my
that money.
pocket.
Yes. Exactly.
Well, in some benefit plans, you have to pay it first. In others, the benefits are tiered until you meet the deductible, right? So some benefits will say, we will pay 80% until you meet the deductible, and then we will pay 100%. Does that make sense? What is, Jessica, what's your deductible? Oh, you two work for anti company. So deductibles could be tiered. Again, some plans are like you have to pay the deductible first, especially if you get an indemnity plan. You must pay your deductible first. But other plans, your employee sponsored plans are just saying, hey, look, we will continue to pay 80/20, or we will pay 70/30 until you meet your deductible, and then at that point we will pay 100%.
So, excuse me.
Yes.
What if your car don't have any deductible?
Your card doesn't have a deductible. What does your card have? You want to bring your card? Let me see what it says.
Sister, it works for UPS. They get everything free.
Well, you might be from another company that has
No,
a lot of wonderful benefits.
full coverage.
Mine doesn't have a deductible either.
Yeah.
NG Direct.
All right. So you mind I talk about your card? So his card, he has a PCP. When he goes to his doctor, he pays $10. When he goes to a specialist, $10. If you go to the hospital, no copay. If you go to the ER, $25. If you use your tier one benefits, you have an in network deductible of nothing. If you go out of the plan, you have $1,000 deductible max, out of pocket max, and then the rest of it is wonderful. And then for your family, if you go out of pocket, is a $2,000 if you do family tier one. You have a wonderful, very nice insurance here. $10.
Mine is a secret. Oh,
That job.
Mine doesn't have.
Mine is horrible.
see how mine is a secret?
But at McDonald, you ain't got nothing here. It looks as if your company might pay everything. You know, Anthem is a so let me just say this. Blue Cross Blue Shield is a company that is in probably all the states. It's called different things in different states. Anthem is from where? Tell me if you let me see if you know.
I don't know.
Horizon is New Jersey.
Anthem is New York.
Anthem is huh?
New York.
Anthem is New York. Sometimes people say Anthem is also New York and Pennsylvania, but Anthem is New York. So I don't see you paying anything for anything on this card here.
Hey, it's a secret.
Now it might be. Do you pay when you go to the doctor?
That's the thing.
And they give you back money, so you don't count.
Exactly. Just fire him. Just take it.
It's a secret.
So this card here has an in-network. Okay, so every time this person goes to the primary care doctor, their co-insurance is $20. If they go to the specialist, it's $25. If you go to an urgent care, it's $25. If you go to the ER, you have to spend $200, but they'll waive it if you're admitted. If you go for preventative care, that's a very important. A lot of things are waived for preventative care. If you go for your annual pap smear, your annual doctor checkup, they'll waive that, but it's waived. In-network coinsurance is 10%. Then you have a deductible here if you go in network of $200, an outer network deductible of $700. Is this a family plan?
Yes.
So for family, so your outer network, you would have to pay 700 in network $750. Your family deductible is $1,875. Now your family out of pocket maximum, when I mean this is really catastrophic. You know, we pray never get here. It's at $9,000, and then they just keep paying. They don't even look back at you. But the fact that if you have to get such a high cost, that means somebody in your family was pretty sick, and most of us don't get there. So we talked about deductible. All right, this is pretty good. All right, so oh, I have another one. Oh my gosh. Well care, no co-payments. Boom. That's what they say. No copay. This is an HMO. So this is interesting. This is a D-SNP. So this is an HMO. So if you don't have any outer network benefits, so long as you go in network, you ain't got to pay a dime. That's as simple. This is what this is saying. All right. So just a couple of more things that I just want to go, and then we'll be done. Medicare. I just want to look. Okay, let me just back up. Medicaid. How do you get Medicaid?
Poverty.
A what?
Poverty.
Not quite poverty.
You have your income or
Your limited income doesn't mean you're poor. It just means your income is limited. You can you own a house and get Medicaid?
Yes.
Yes. The only thing is that God forbid you should pass, the government can come back for their monies. Is Medicaid state or federal? Where did they get? And that's a lot of this argument in the news right now. Is Medicaid state or federal? Federal?
States.
Medicaid. Medicare is federal. I'm going to get Medicare when I turn 65. All of us who have worked 30, 40 quarters are going to get Medicare, eligible for Medicare. And by the way, NJ Direct, let me just say this as a side note. NJ Direct and many of the plans, New York State, New Jersey, you will always have that secondary. You probably don't need to get no D or anything. You will always have that secondary if you put your 25 years in. Always have that secondary plan. So whereas a lot of people, Medicare will become primary when you turn 65, but that NJ Direct or that New York plan will continue to pay all your secondaries. There you go.
But I'm not of the age yet. So they offer me the coverage. So when I be 65, they're still gonna offer me Medicare.
Yes, you will, and Medicare will become primary, and then your other insurance will become your secondary, and it's going to be pretty awesome.
Yes, I'm getting there.
So Medicaid, going back to Medicaid, how do we get Medicaid?
Well, like I said,
Limited income.
when I say poverty, I'm saying that every state has a poverty level,
Mm-hmm.
and you have to be below that to be
Mm-hmm. Medicaid is also needed to pay if you want long-term care. If you can't afford it, you have to have Medicaid. A part of Medicaid will pay for long-term care in those facilities where you see people live in. So that's a lot of them who cannot afford it use Medicaid. So limited income funded by the state, some federal monies, and that federal monies is what they're looking at right now and having all that argument about how much federal monies goes into Medicaid. Because I'll tell you two things real quickly, and then I'll do Medicare, and then I will be done. Hospitals, part of the funding for Medicaid funds and undocumented, uninsured people. So if I were undocumented and uninsured, I go into the hospital. There's an EMTALA that says the hospital has to treat me regardless of my ability or inability to pay. So it doesn't matter what I need in the hospital, whether it's $1 million surgery, and I show up in an ER, not electively. Now, if I I need knee surgery, we all can electively go. But if you are undocumented, uninsured, and you show up in the ER, the EMTALA law, the federal law says the hospitals are required to treat. Now, here's the problem. When the hospitals treat, they ain't getting a penny for the treatment, right? So, what this argument now is about is how much funding goes into that because it's part of that Medicaid funding. And so, hospitals are really, they have what's called charity care. But charity care doesn't really, it exists in paper only, but it doesn't really exist in hard money. So the hospitals will get X amount of dollars and they will treat X, they have, but it doesn't go up or go down if that's the money allocated to them. So they're looking for additional funding. I guess they had additional fundings in the Obamacare, and they're looking for that to continue because we treat, one of my hospitals is in Trenton, and we treat a lot of people who are uninsured. But there's no monies, and you can't say to them, well, because you're uninsured, you can't get care. In England and those places, I don't know how it works, but in America, we have to treat. The problem is aftercare, but you have to treat in the hospital. And whether or not you need care that costs you $5,000 or $5 million, that is on the hospital. So that is part of the Medicaid monies. So my final thing I just want to run through with you guys, and then I'll be done. Tell me what Medicare A covers. So Medicare A, B, C, and D. Those are the Medicares that are out there for all of us when we get to 65. Medicare A, Medicare B, Medicare C, Medicare D. Well, let's start with D. What is D? Medications, prescriptions. Like I said, you have to pay to get it. It doesn't come when we work all these years, it doesn't automatically come. So we have to pay a deductible and a premium to be able to get D. So what is A cover? I, who? Hospitalization. What else?
Skilled nursing care.
Skilled nursing care. Very good. What else? Well, if you're in the hospital, it's part of surgery.
Hospice also.
Hospice. What else? I need a little rehab. I need rehab.
It's long-term care that would be.
Not long-term care. In the hospital, I had a hip replacement, but I can't go home. I need rehab. Which part of Medicare covers? No. A. Medicare A covers up to 100 days of inpatient rehab. However, day 1 to 20 is covered at no cost. You begin to have co-insurances from day 21 to 100. Same thing with hospital. When you go to the hospital, there's a premium. I don't know how elderly people survive in this country. I think it's like $1,600 or something from the first few days. Let me see if I have it written down here. Inpatient hospital deductible is 1,676 for the first 60 days you're in the hospital. You also have a co-insurance of $491 for day 61 to day 90. Very expensive to be elderly in America. Very, very expensive. So going back, Medicare A covers, what did we say? Hospitalizations, rehab, hospice, and what else did we say? No, but rehab is up to 100 days. Day 1 to day 20, no co-insurance if you're going to rehab. Day 21 to 100. Now, some people get elderly and they use up all their time. They have to go into their lifetime reserve. That's for another time. So, Medicare A, hospice, hospital, rehab, hospice. Medicare B, what does Medicare B cover?
Doctors. Doctors.
Doctors. If I go to the ER, specialist is part of doctors. If I go to the, sorry? Outpatient care, yes. What else? If I need a walker, I need a wheelchair. Which part? B.
Long-term care, right? 90 days.
Long term care, we have no benefits for long term care. You have to have Medicaid. Medicaid, or pay for it out of your pocket. All that money that you put in your pocket, all that money you have, will pay. You have to pay for it privately.
You see my card? This is the
Um,
worst one
All right. Ambulance, preventative services, emergency room. We talked about Medicare C being that you use your Blue Cross or whatever to manage all of it, and we talked about D, prescription drugs, and all of that. All these plans have yearly deductibles. I have lots more, but I'm pretty much done. Tell me what questions you have for me that I haven't answered.
I have one too. For Med B, so when they come to me from the hospital to the skilled clinic, um, we're always checking for how many days they have
They
left
have left.
of the insurance. So you try not to get someone who has used up all of their days. Sometimes we get patients that have no days left, and then we have to find, private pay or blah blah blah. But um, you said they use Med B for
Med B is outpatient services, doctor's visits. They're using their Med A.
they're using it.
When they're coming in for rehab
Mm-hmm.
out of the
Med A.
hospital, now they would have had to have a qualifying stay in the hospital, at least
Right.
three
Three
overnights,
overnights, yeah.
which is oftentimes a problem
And
for us. They
and
have to have three overnights
and then skill.
and a skill,
Yeah. Two.
OTPT or
Yeah.
whatever. By the way, also Medicare Part A does cover LTACs if somebody's on a VELT. Medicare Part A also covers acute rehab, the Kesslers of the world, the JFKs of the world, spinal cord injury. That's Medicare Part A. But they would have had to have a skill. They would have had to have had a 3 night
Night
stay,
stay.
and they also have not used up all their days.
Right. And
And they would have had, if they used up all their days, they would have had to have been out of the hospital for 60 days
yeah.
for that benefit period to
Right.
recycle. And some elderly folks are not out of the hospital that long. They will
Right.
use up all their time. They come,
So
they
we,
can't go.
we try to keep them in. Like sometimes you'll have a patient, they're close to the 60 days, maybe 2 days short of it. So that's where we try to have the clinician come in instead of sending them out. But you talked about Kessler, and I worked at Kessler for like 8 years. They are a stickler when it comes to their money. Like if Med A isn't there or the cash, you will not be. You could come to them, ambulance dying, they will not.
Can I tell you guys something just about cost? And I don't know the actual cost. In the For a skilled rehab, you go there, it's typically anywhere from $300 to $600 or so per day.
A day, yeah.
Per day. If you do acute rehab, the Kesslers of the world, it can be over $1,000 a day.
It's a little bit more than that.
Well, yeah, at least that's what I said. At least, if you do an LTAC, it could be $2,000 a day or more.
Oh,
If
shoot.
you're in the hospital one overnight, based on the contract of that hospital with the insurance company, it can run
10,000.
anywhere 3, 4, 5, $6,000 a day. It is healthcare in the United States is exceptionally expensive.
But
So,
why?
why is it that way?
Yeah,
Well,
because
that is the rate. It's just like prescription drugs. That is the rates that the hospital and the insurances have agreed upon. That is the reimbursement rate.
that's true.
Well, and it has to do with trying to balance. Remember, for you to lie in a bed, there's a respiratory therapist, there is a multiple nurses, there are people who have to clean the floors, there are phlebotomists, there's food. There are so many people who go into, as an administrator in the hospital, there's so many people who go into providing that care for the one patient to later. And then I always tell them, if they don't pay me, I'm not coming back. So they have to pay us also and then maintain the hospital as well. Go ahead.
I think one of the reasons why healthcare is so expensive in this country is because of a profession that's not even in the hospital. They're called lawyers. Lawsuits are a big contributor to the cost of healthcare in
Well,
this
I
country.
tell you what is where the litigation part comes in. Doctors will keep people in the hospital unnecessarily so, or work them up unnecessarily so, for fear of litigation. And because we're such a litigious society, doctors will say, no, 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 part of what my team does, my nurses, my social workers, is discharge planning. But sometimes we can get the doctors to be on the page that this could be worked up outpatient because they're fearful they'll send you into the community, you won't go for the workup. And so they keep you in the hospital to do the workup, which can be done outside. And also of note, hospitals are not paid for the day of discharge. So when you lie there on the day of discharge and you're getting all these services, hospitals are not getting paid. But the doctors will have the colonoscopy before you get discharged, this before you get discharged, because they're very fearful that you won't follow up and then you will come back and sue them. And so the cost is impacted by how quick we are to sue. What else do we have before we wrap up? What other questions do you have? I'm just about to close and say, go ahead, my sister.
Could you just cover what Part C covers in health?
Medicare Part C is when you decide to go to United or Blue Cross or any Aetna or any of those and say, hey, I am going to pay you a premium for you to manage my entirety of my Medicare for me. So they give you rehab, they give you A, B, and D. They will give you Medicare Part A, all your hospital services. They'll give you all your outpatient services. It's good and it's bad. It's good because there's a monitoring of this. It's bad also because the insurance companies looking at the rules, it may be a little slow versus a little slower versus Medicare. You just go in the office and they do whatever, and then they wait and pray that Medicare doesn't accuse them of fraud or waste or abuse. But typically the private insurances. But I think there's a lot of benefits to having C because you don't have everything is covered for you and you just use one card.
And many of them will give you free gym membership and free
A lot
this
of them
and
they
free that.
incentivize you to have it. Yes, Sister Kuja.
Yes, on my card I saw clearly it said medical tier 1 and tier 2
Oh,
with
that's
deductible different.
okay. The benefits. So insurance companies are now looking to tiered services. So they will give you a better if you use tier one, they typically will have you would have less cost sharing than if you go to and that group is very limited, right? But if you want to expand, you can go to tier two, but you might have to pay more money to use a tier two doctor. Doesn't it just means that your horizon becomes wider? For example, let me tell you, I wanted PT, but if I went to my hospital, it's tier one. But I went to a PT place down the street, it's tier two. So every time I went to PT, I paid $35. Now, if I went to my hospital, I would pay zero. But because I decided to go where I wanted, they still paid, but I had a cost sharing in it. So tier one will give you will maximize your benefits. You will have less cost sharing. Tier two, tier three, you will have more cost sharing, but it expands your horizon, expands your options of people to go to.
So when you said tier 1 is basically mean like HMO.
It is like an HMO. It restricts you where to go. But I will call it, but it's not necessarily gatekeeper driven. It just says if you use these doctors in this or these providers, I should say not doctors, but providers in this network here, we will give you the best out. I mean, we will not charge you. But if you go outside of that, we will charge you for your options. Yes, Bo.
Yeah, not sure. I mean, if you don't know the answer to this, it's okay. But I work with a lot of physicians, and they don't want Medicaid patients. And what they say is that if they do the same exact treatment for a Medicare patient and a Medicaid patient, they get paid more from the Medicare than Medicaid. And
Yeah.
it's the same government paying them. Wow.
Well, not necessarily the same government. Remember, I said the state,
Oh, say, yeah, yeah,
the
yes, correct.
state is
You're right.
funding Medicaid
Right.
with some federal monies and the federal government. And remember, guys, we paid into Medicare. They take from our paycheck every time we work, they take monies out and put it there for our Social Security and for Medicare. They're not taking monies out for Medicaid, right? And the second thing is some doctors, Medicaid a lot of time has capitation, meaning that the doctors don't get any more monies for seeing more patients. And so the reimbursement is very low on Medicaid. But if that's what a person with low income can afford, it's better than nothing. Yeah. I think I have covered a lot of insurance. I hope I have been helpful. Yes, you with the very good insurance.
Yeah, exactly. Sit down, brother.
Better than mine, but go ahead.
You know what insurance used outside of the country, like Scotland or wherever it may be?
So that becomes very tricky. If you have an HMO, it's not going to pay. Now, it depends. PPOs will probably pay because you have in and out of network benefits. But a lot of you would have to make a claim to your insurance company if it's an emergency and you show up in somebody's ER, right? But oftentimes HMOs won't pay. But point of service and PPOs, because you have that out of network benefit, you probably could make that claim that I went to the ER, it's an emergency, and as such, I needed the care there. You might have to pay for it out of your pocket and go because there is no way to reimburse the out of country insurance. So you might have to pay for it and look to them like to send you a check back. Yeah, but every time I travel, I pray God don't make me get sick and go in somebody's ER, you know. But yeah, you probably have to pay for it on a credit card or something, and then pay. But there's no way other than Puerto Rico and probably the Virgin Islands or any U.S. territory, you would have to pay for it yourself and then try to make a claim to your insurance company about emergent care. Sorry, is that the same for Medicare? No, Medicare, you know, Medicare is a United States benefit. It is more than likely, and I don't know, don't quote me on this, I would say probably not because it is a federal program. I don't know how you will get your money back from the US government. I mean, and I don't know the answer, but I would think probably not. But maybe there are exclusions for people who travel. I don't know.
Some part C's.
Well, Part C, you're using a health plan to monitor it for you, so you can make the claim. But if it's A and B, if it's traditional fee for service, what we call traditional Medicare, and I have a Medicare card, has A, has B, I would say less likely so. Somebody else had their hand up before I go. Yes, my sister.
I'm not too sure if this has to do with the in your area, or I'm wondering if the hospital can also argue the point that the patient is it's the patient can should stay medically. It is medically necessary for the patient to stay.
Well, we do appeal.
Oh yeah.
Yeah.
I mean, just recently, my hospital has over $2-3 million of losses, and we are appealing, and we do appeal. But the standard is there's two standards out there: evidence-based medicine. One is called MCG, and one is called Integral. The insurance looks at them, and we look at them, and the insurance will make the claim that it wasn't necessary or could have been rendered elsewhere, and they won't pay. But we do appeal. There's a process also, and when you go into the hospital, you sign to say that you give the hospital the right to appeal on your behalf. Now, let me just say this: even if the hospital is not paid, unless the hospital tells you you must go, you are not billed. You cannot be billed. Unless the hospital discharge says you must go, you cannot be billed. The hospital just doesn't get any money. And if you have Medicare, whether primary, secondary, and you think that you shouldn't go, the federal government says you have a right to appeal that discharge. Only Medicare. Federal government says you have a right. We have to give you a notice of discharge. And you then say, I don't think I'm ready. Medicare has Levanta, looks at it, and they will say, well, we agree or disagree with the hospital. You don't have to stay. If they agree with the hospital, you must leave the next day by 12 o'clock, or you can get billed. If they disagree with the hospital, then you can lie down there until the new discharge order goes in. But again, if you're Medicare, not regular insurances, Medicare A, and you're in the hospital, you have a right to appeal that discharge. Anybody else before I wrap it up? I hope I have been helpful and explained your insurance. It is, we are, we live in a great country and we're blessed to have great care. I want you all, when you pick your insurance, to think wisely. I also want you to use your preventative care services on your insurance. I want you to go for your annual women, your mammographies, your pap smears. If you're over 40, your colonoscopies. Men, get your prostate exams. Go for your annual exams. Especially you black men in here, please go for your prostate exam because it is not fun. Go for your colonoscopies. They can identify polyps early. You don't want, black men die so often from prostate cancer, it's really not even necessary in this time. Go for your colonoscopies, men. That might not kill you. But prostate cancer, colon cancer, go for your colonoscopies. You just drink something for a little bit, you go, they knock you out, they look up, they make sure there are no polyps. Your prostate exams, some of you don't want the physical exam, it's not going to kill you. Women, your annual mammographies. If you have dense breasts, the state of New Jersey say you can have an ultrasound associated with that. Some self-funded plans won't pay for it, but fight mammographies, your pap smears must be done annually. Please go and see your doctors and use your preventative care. We are fearfully and wonderfully made, but God also gives us common sense.
I think, Sister Diane, do you have something?
She was just saying yay to me.
Oh, okay. Oh, okay.
She said she had her prostate check done.
Her husband is
Hi. Yes, my brother.
Yeah. At what age should the men go get the prostate checkup?
What age do you think?
Over 40.
What age do you think? I feel like it's a mischievous question to me. So what age do you think? You see, it's the look like what age do you
Like
think?
50, right? 50 is the right age, or?
Well, first of all, you should discuss it with your doctor. But if you're 50, you should. But I would say 40, you begin having a conversation with your doctor as when it's the right time for you.
Okay. And how often though can you do it?
Every single year that God gives you life.
Really? All right.
I know some of the men don't want another man doing this to them. So I have a female urologist if you're interested.
Well, whether it's
Very
female or male, the digital exam,
She's very gentle.
the
Don't worry.
so the digital exam is not going to kill you, but certainly you can ask for PSA. But the digital exam is better.
Yeah. Brother, talk to me. She's very good.
All right. Thank you, everybody. Thank you. Thank you so much.
Okay, so Sister Cynthia Ulysse, I forget the pronunciation, Saint Elise, Ulysse. On behalf of University Heights Seventh-day Adventist Church here and the Health Ministry, we want to thank you for such valuable information. Yeah, very valuable information. Sometimes we lose out without doing those examinations, and especially when we reach to the age of Medicare, some of them we can't get some of these tests done. So we are grateful to have you for the time, your effort, and everything. Thank you. Thank you. So, can
Could we have
a
Darren
prayer?
and Jessica? We have a final song
Encore.
since we missed it. Thank you so much, Darren.
Oh, yeah. Social distance, exactly.
So they'll sing.
Oh,
Thank you so much.
they want to sing or we singing? Okay, all right. I thought that was close. No, no, no. She asked me for closing prayer, but I don't know if they're going to
Yeah,
sing.
they,
Okay.
unless you're gonna sing with them.
No.
You're welcome.
So during COVID, they sang this song that I really loved.
Mm.
The Passover song. So I just asked them to do it again. Every
Hello again, everyone.
So they haven't practiced, so that's what they do.
Yeah.
We have faith.
Thank you. Praise God. My mind looks back to the last great night when my God searched for the blood. When he saw the red resting on the post, then my God passed over us. Can you hear the children sing to the mighty King of Kings? They say, I am covered, for my God passed over me. I'm alive today, my sins erased, for the blood has covered me. We prepare to march out of Pharaoh's reach, but we dressed in maiden haste. When the hour came, God delivered us, then we were no longer slaves. Can you hear the children sing to the mighty King of Kings? They say, I am covered, for my God passed over me. I'm alive today, my sins erased, for the blood has covered me. How can I forget on that great day when the Christ died for the world? He became the Lamb, perfect sacrifice, freeing every boy and girl. Can you hear the nations sing to the mighty King of Kings? They say, I am covered, for my God passed over me. I'm alive today, my sins erased, for the blood has covered me. I am covered, for my God passed over me. I'm alive today, my sins erased, for the blood has covered me. Salvation, Jesus bled and died for me. I'm alive today, my sins erased, for the blood has covered me. For the blood has covered me. For the blood has covered me.
Closing prayer. Thank you, Sister Cynthia. So, Sister Pauline said that you explained it better than all those people that are doing the Medicaid Advantage plans. And I said, of course, because those people only know their product and they're trained to sell that product only. They don't know anything else. They don't want to know anything else because it doesn't pay them to know anything else. So we thank you very much for that. That was excellent. Reminds me of how, again, poor my insurance is. And for those with great insurance, please use it. Get all your medicals. Have as many kids as possible. Have some more. I wasn't looking at you, Sister Mighty. All right, let's pray. Our Father God in heaven, we thank you so much for
the wisdom and the talent that you've blessed this church with. We have everything in house, and we thank you. I pray, Lord, for more opportunities to share, to be able to share this with others, to empower you. We're told that that in the multitude of counselors that there's safety, and we just pray, Lord, that you allow us to be able to tap into this kind of resources that we have, and through that wisdom and knowledge to be able to be better stewards of what you've given us. I ask you, Lord, that you bless Sister Cynthia and her family, bless us, Father, and bless your church. In Jesus' name we pray. Amen. Amen. Is there AY study, anything like that? Nope.